Crohn's is a condition in which there is a chronic inflammatory response that is unregulated. They get a chronic relapsing and remitting inflammatory process that manifests itself as diarrhea, abdominal pain, sometimes malabsorption, weight loss, sometimes bloody stools, in rare cases abscess formation or formation of fistulas between different loops of bowel. It's a chronic relapsing and remitting inflammatory process, and it doesn't turn off. That's the problem. Crohn's is most commonly something that presents in the late teens to early 20s. I've seen it as young as age 3 or as old as age 90 in a de novo presentation. So it can be anywhere in that range. The peak incidence is between 15 and 25 or 30. We can broadly categorize this into a few groups. 5 ASA agents, 5 aminosalicylic acid agents. Those are things that are topical anti-inflammatory agents that usually ingested orally, sometimes administered rectally, that will help to decrease inflammation at the mucosal level, at the level of the surface of the bowel. Then you can use prednisone or other steroids. Those are short-term things designed to remediate the acute inflammatory process. They're not long-term therapies, but we do use those in patients to kind of get the inflammation calmed down. You can use biologic agents. What I mean by that are things like anti-TNF antibodies, like the anti-adhesion molecule antibodies. These are these drugs that have been biologically engineered to specifically target things that drive the inflammatory response in Crohn's and ulcerative colitis. And then you can use immunosuppressive agents. These are things that actually suppress the immune system and decrease one's immune response to enteric pathogens. The goal with those folks is to get them into long-term remission.